Hi, I'm Quinn Lemley with Secrets of the Stage. This is the place where we pull back the curtains on the creative process. And today I am so excited because this is really creative. I have Dr. Barbara Bartlik, a sex therapist and a psychiatrist. Welcome, Barbara.
Thank you, Quinn. Thank you for inviting me.
Oh my gosh, I heard you speak the other day at the Three Tomato Summit, and you were just so captivating because you encompass the wholeness of people, of our beings, of our health, of our mental, physical, and spiritual selves.
Yeah, it was so exhilarating to speak to that group. I was very excited to be there.
How did you become 3 different modalities? It's so rare.
It's a long story. I started by going to medical school, graduated that, then did a psychiatric residency at NYU.
All right,
became
NYU.
a psychiatrist, and then after that, I got interested in sexual medicine, and I studied with Dr. Helen Singer Kaplan, who's a very famous pioneering sex therapist who is no longer with us, but she was one of the leaders in the field of sex therapy. And I did sex therapy and psychiatry for many years. And then around 2000, I got interested in integrative medicine.
Yes, but now with your book, Integrative Sexual Health,
right,
you're combining it all together.
Exactly. That's just the point. I'm so glad you picked up on that. So I was interested in natural healing methods and traditional therapies and botanicals and vitamins, minerals, and herbs. So I studied all this for many years, and then they came out through Dr. Andrew Weil at his center in Arizona. They came out with an integrative medicine subspecialty in
for sexual health?
For board certification. You could get board certified in integrative medicine.
Wow.
Going through his fellowship. But since I had done 10 years of training in integrative medicine, I did not need to do the fellowship. I simply had to take an exam to show what I already knew. So then I became board certified. And
that is exciting.
So I have 3 board certifications, integrative medicine, psychiatry, and sexology.
And how do you know, well, which modality to use? Because you're a traditional doctor
I'm a
as well.
traditional doctor too, and people consult me about all sorts of problems. You know, it could be related to their sex life or their mental health or their general health, because they all feed into one another. And that's what we've done with this book. We've looked at all of the factors that go into making a person having good sexual health. And it has to do with keeping your body healthy, eating the right foods, getting the right nutrients, and all these things that you can do. We've summarized the research, and everything is evidence-based. Research backs up what we say in the book.
Does the FDA endorse integrative health at all for
there are some integrative therapies that are FDA approved, but sometimes they are approved for other purposes, but not for sexuality. But doctors, it's legal for doctors to use treatments that are approved for other things for another application. It's legal, but it's not FDA approved for that purpose.
I understand. Yeah. That's interesting. When we were talking earlier in the green room about trends, what's trending with sexual health and sexuality in 2025? I thought that was a very interesting conversation we were having.
Yes, yeah. You know, I wanted to highlight 3 things. One is the decline in testosterone in men.
Why? Inquiring minds want to know.
Yeah. Well, let me just say 2 and 3. 2 would be the decreased sexual activity in couples and individuals in recent years, and 3 is pelvic floor issues. So I'll start with number 1.
Okay.
The decline in testosterone. Well, it's for the last 40 years, men's testosterone levels have been declining.
Is it what we're eating or drinking, or is it our mental state?
It's a all
I mean,
of
everything
those.
that's going on in the world.
All of those, yes. Okay, so the way the testosterone is, man's testosterone is high until age 30, and then it starts to go down very slowly as he ages. Right now, a man who is 22 years old has the testosterone level of a man who is 67 years old 20 years ago.
Oh my goodness.
Testosterone levels have fallen 20% in 20 years. Okay? So 20 years ago, the average testosterone level was 600. Today, it's 450.
Oh my goodness.
Okay? Now, when you think of what low testosterone does to a man, it is pretty bad. It can, okay, of course it affects their sexual desire and their ability to maintain their erections, but it also affects mental health. A man is more
His
likely
desire to make
anxious, anxious and depression. Like, you know, you take a person with low testosterone and they're having psychiatric symptoms.
That makes sense.
And then give them testosterone replacement therapy and those symptoms go away. So a lot of people out there who are suffering from depression, anxiety, any psychiatric symptom, insomnia, that could be low testosterone.
So even women?
And women too.
So
women
we
too.
have testosterone as well.
We do have. We have much less, about 1/20th of what a man has. But when women have low testosterone, they don't feel so good either. And that could be a cause of depression. And certainly it's a cause of low sexual desire.
And what about women? I mean, are women not wanting to make love in 2025?
Well, that comes to the other point I wanted to make, the decreased sexual frequency. Okay, prior to the pandemic, the frequency of sexual activity in couples was on the decline. Okay, from 2008 to 2018, when they did this major study, there was a decline in sexual activity.
Wow.
And then the pandemic came, and that further reduced sexual
Really,
activity.
I would think that there was nothing else to do.
You are absolutely right. That is what everybody thought, okay, that people were on lockdown. They couldn't go out. What else could they do? But people were isolated. People had trouble dating. They were having Zoom dates, etc. There was a lot of concern about infection. And the ultimate result was that there was less sexual activity during COVID.
Interesting.
Right? And we thought, okay, when we're over this, it'll pick up again. Well, guess what? It didn't. It's still very low.
Do you think people are afraid to meet people or have sex? But I remember when I was coming of age, I mean, I was, 17, and I was living in Europe. I was living in France, and my mom and I went to Italy. And so we're in Rome at the Trevi Fountain, and we meet this really handsome like he's in the military or whatever. And he's like, I'm so afraid to go to America because of the eggs disease. And I'm like, eggs disease? What is our eggs disease? And he's like, you know, the AIDS. So I asked my dad, I said, what's going on in the United States with our eggs? And he's like, no, Quinny, it's AIDS.
Yeah.
And so I grew up in a time where, you know, we were very careful.
Right.
So what is it like now?
And people are more careful now. You know, young people are not drinking alcohol as much. And a lot of sexual activity was fueled by alcohol. You know, people taking chances.
Taking a chance,
yeah.
right.
And people now inquire about their partner's sexual history now and may require tests and everything. So people are more careful now.
Wow. And you were saying something about the pelvic floor.
Strengthening the pelvic floor is extremely important for sexuality and for bladder function, right? And in the conference on the other day,
ad you played was so brilliant. But
love that.
I have friends, and I know people that are saying, "Oh my gosh, I'm having this problem."
Yes, I would say about 50% of women over 50 have it. The studies show that 75% of women over 65 have incontinence problems.
Wow.
And for women under 65 and over 50, 43% are affected. So if you're an older woman,
Do your Kegels.
you must do Kegels. And in
Kegels.
fact, I think Kegels should be started in high school, really. I do
Well, they
think
can
so.
do that while they're sitting in a lecture.
Exactly.
Nobody needs to know.
But that should be part of sex education, you know?
Right.
People should be taught. I mean, we're taught to do exercise, and certainly general calisthenics will help the pelvic floor, thrusts and pelvic lifts and all that. They do strengthen the pelvic floor, but you should learn to isolate the pelvic floor muscles, like when you tighten your bladder outlet. When you want to stop the flow of pee, that's tightening the pelvic floor muscles or tightening around the anus. People should learn to do that exercise and then repeat that 10 times, several times a day to tighten, hold it for 5 or 10 seconds and relax and isolate those muscles. But a lot of people don't know how to do it right, and it's been shown on ultrasound that instead of pulling up the pelvic floor, they push down.
Really?
Okay, yeah. So sometimes you have to be trained to do Kegel exercises the right way.
I was surprised when you said that men need to be doing this.
Yes, okay. Kegels are very helpful for men too.
I completely didn't know that we had the testosterone. I didn't know that men should be doing the Kegels.
Yeah, Kegels help in men. They help men maintain an erection. This has been studied. They help premature ejaculation, and they help bladder control. You can improve sexual functioning. Oh, and orgasmic pleasure as well is improved, because when you have more muscles in the pelvic floor from exercising them, there's a greater release on orgasm. So orgasmic pleasure is increased in men and women. And in fact, sometimes a patient comes to me, and usually a woman, who says, I'm having orgasms, but they're just not that pleasurable. They're weak. So the prescription is to tell them to do Kegel exercises.
And it helps?
Yes.
Wow. I know this is a strange subject, but do you have clients that ever come to you and there's depression because they feel like they don't ever have an orgasm, or they fake orgasms?
Oh, your questions are so good. I'll tell you the science of orgasm. When you have an orgasm, it's like you have a mini seizure. So many neurochemicals are released. Your brain is just bathed in neurochemicals, neurotransmitters. It's like a huge antidepressant burst.
Wow.
I have a personal theory. It's never been proven, but I think that people who don't have orgasms on a regular basis are more likely to get depressed.
Really? Oh, of course.
Lose
that
energy.
Makes sense. Yes.
Yeah. It's therapeutic.
So have your orgasms.
That's right. That's
Yes.
exactly right. Have your orgasms. I would
How
say
many
at
times?
least once a week.
Once a
week, maybe more, twice a week. Okay. Also, with orgasm, this feel-good bonding chemical, oxytocin, is released in high amounts, and it lasts for a couple of days, and people feel a little more relaxed. And that's been shown in studies where people had to get up and give a speech, and there's nothing more anxiety provoking than that.
People say they'd rather die than speak in public.
Exactly. But if they have an orgasm the night before, they have less anxiety.
Oh, that's good to know.
Yeah.
So when I teach about performing the stage fright portion, I'll say have an orgasm before.
That's right. So it's very good for you. And sometimes I have patients, and then the medications that they take. Look at those antidepressant medications. They are sex numbing, okay? People don't want to have sex when they're on them. or if they do try to have sex, they have to work so hard at it, they may give up.
That's a good point. When people have problems with their, whether it's cancers or women or men, how do they continue to have a sex life and feel relevant and feel beautiful and sexy and?
It's a big issue. Okay, when people have had a serious medical illness and maybe there are changes to their body, maybe they've been on chemotherapy, which really knocks out the functioning. It's you want to work with them. They need a sympathetic partner, empathetic partner who's supportive, who can make changes as necessary. Okay, maybe they can't have sexual intercourse anymore, but we don't want them to give up having sex.
Do you find that people do give up having sex?
Yes. So for some people, having sex means having intercourse, and that is just the tip of the iceberg on what you can do in having sex.
Well, what's your definition of having sex?
Having a sexual experience that's pleasurable for one or both partners, that involves some kind of sexual stimulation in the woman directly on the clitoris and the man on the penis, that hopefully leads to orgasm. And I think it's healthy, and it should be a normal part of your healthcare practice.
I think that's a good idea.
Keeping sex alive in a relationship. We all have downsides where, down times when you may have an injury, an accident, an illness, something that really knocks you out. And sometimes there's a period in the relationship of several months where people are not sexual. Very often that can be the start of sexual retirement for some couples.
Sexual retirement, that's a powerful word.
Yeah. We want to fight that.
So do you think that couples should, even though they're not feeling like it, show up in that area of their life?
I do. And sometimes people don't want to. They come to see me in sex therapy, and I recommend that they proceed and try, and they may resist,
So how do you
but very often,
nudge them?
You got to give them support, okay? And that might be the support of some sexual aids,
You mean
lubricant, vibrator, also some nutritional support.
Like what kind of nutritional support is good for sexual?
There are about 10 vitamins that are good, vitamins and minerals. Okay, magnesium, very good for blood flow. It opens up your blood vessels.
Okay.
Zinc is very good for testosterone production. Vitamin C, also good for blood flow. B12, necessary for neurological functioning. Folate, also, and B12 and folate and B6 are also.
What is folate?
Folate is B9.
Okay.
And and niacin, B3, all good for blood flow and neurological functioning. Vitamin C also helps make hormones.
I didn't know that.
Yes.
Interesting.
Yes. So, and vitamin D.
The sun.
Right, you need to go out in the sun. If your vitamin D is low, that can actually reduce the testosterone level in a man. And there have been studies that show where men with erectile disorder, they don't respond to the Viagra-like medications. It's not working for them. And they have low vitamin D. They give them vitamin D, and then they can respond to those medications.
Well, I want to talk about Viagra or Viagra-like medications.
Because there are so many of them now.
I mean, I don't know that much about them, but do you recommend them?
Absolutely.
And what if it doesn't go away, or like it takes forever, or is it?
Okay.
Could that be a problem for the woman?
Right. Okay. That is one of the downsides to these Viagra-like medications. makes it can take longer for a man to have an orgasm.
Does he feel satisfied?
Most men are very pleased with it. Okay. It's wonderful. For a guy who's struggling to maintain his erection, these medicines are fabulous.
Wow.
And now we're finding that there are health benefits.
What are the health benefits?
Health benefits. Okay. The men who use these medicines, Viagra-like medicines, more frequently have lower rates of heart attack and stroke.
Really?
Yeah.
Why?
Yeah. Because of the increased blood flow. They open up your blood vessels.
Interesting.
Yeah. So,
well, that's exciting.
That is wonderful news, new research.
Now, do women take Viagra, if I sound
Women have
naive?
been taking Viagra for decades, okay, but it's not approved for women, okay?
So what does it do to the woman's body?
It's wonderful for women.
You're glowing, Barbara.
Women. I think it's great, especially for women who have vaginal symptoms, like the women who have a little pain on penetration, or maybe they're a little dry, and of course we want them to use lubricant, but the moisture that comes about from Viagra is really wonderful.
Really? Wow.
So it also helps women with vaginismus, those women whose vagina just clamps down and they cannot have penetration.
Is that usually a psychological thing from
yes, from trauma. Or restrictive upbringing and fear of sex? So I think it helps those women too.
What's next for you? Are you going to write another book?
Yes, we are. This book came out in 2018. So I'm now working on an update and getting together all the new research, things that I didn't know about when this book came out. We're constantly upgrading the research. And a lot of it has to do with technology.
So our sexual life with technology.
Yes.
So explain that.
Well, for instance,
you can't use AI for sex, or can you?
Well, I think people are. You know, people, for instance, if they want to write a romantic text, they could, just ask ChatGPT to help them. And yes, it does help. It's wonderful.
Now, you have a podcast.
I have been on a few podcasts, yes. And yes, I think I sent that to you. One of them was on one of the technologies I mentioned before. It's called pulsed electromagnetic field therapy.
Okay, that sounds fun.
PEMF for short.
PEMF.
Yes, and it makes a magnetic field by putting an electric current through a wire that's in a coil. You create a magnetic field that way, and you direct that magnetic field to your body in an area that needs healing. And it causes the blood vessels to open and the blood flow to go to that area. So PEMF has been studied on people with sexual problems, and it helps. It helps erections, it helps women's pain, women's sexual pain.
Does it just help for more pleasure? I mean, we can always use more pleasure.
I haven't heard of a study in that, but
right.
It's working for sexual problems.
That's exciting.
So, yeah, and it's also working for bladder problems. So I think people should check it out.
They need to do that and the Kegels.
Yes.
Right.
So I created a section on my website, drbarbara.md.com, and I also have another website called pelvicfloorrescue.org. And I put on there some of the information that people need to know about Kegels and